The mental health support teams, or MHSTs, in school will form part of the mental health approach within education settings, providing timely, evidence based support, care, and interventions for children and young people who are experiencing mild to moderate mental health problems. They will also support children and young people who present with developing or emerging problems and may provide support for those who present with more complex needs, which will require signposting to other services. The MHSTs will also work with senior mental health practitioners to support wider whole school approaches to mental health and wellbeing across the education setting, including advice, consultation, training, and psychoeducation. The MHSTs are early recognition, early intervention, and preventative. They are based within schools to provide a timely response and easy access to services. They offer low intensity interventions. These are short term and very prescriptive in response to anxiety, low mood, and conduct problems. Mental health in schools teams are currently available in the schools and colleges listed here. MHSTs intend to provide a number of services to help support the mental health and well-being of children and young people, including delivering training and workshops on mental health for students, staff, and parents or carers, contributing to the whole school approach towards mental health to reduce the stigma or negative views surrounding mental health problems and promote mental health, providing consultation to schools on mental health and well-being, as well as providing early individual and group interventions for children and young people who are experiencing difficulties managing their mental health and well-being. So, what difficulties can the MHST in your school help to support your child with? The MHST can help by providing early intervention on some mental health and emotional well-being issues, such as mild to moderate anxiety or low mood, specific phobias that might be impacting your child's life and well-being, or even OCD. The MHST can also help to signpost you to other services that may be helpful. The Mental Health in Schools team consists of education mental health practitioners and mental health practitioners who are overseen by senior mental health practitioners. The MHST is overseen by a clinical manager. The role of the Education Mental Health Practitioner, or EMHP, is to offer support to young people struggling with some mental health and emotional well-being issues by providing brief, evidence-based interventions that typically last 6 to 8 sessions. The role of the mental health practitioner, or MHP, is to support young people by providing evidence based cognitive behaviour therapy interventions that typically last 8 to 10 sessions or more. The role of the senior mental health practitioner, or SMHP, is to work closely with the staff in school, offering consultations, advice, information, and signposting. The SMHP will also support young people by providing evidence based cognitive behaviour therapy interventions that typically last 8 to 10 sessions or more. Since the MHST works as part of the school, some designated staff members are involved in the referral process and will be informed when a young person starts and finishes working with the team. However, the content of the sessions will remain private and confidential if a young person wants it to. There may be times where it would be helpful to involve teachers or parents and carers, but the mental health practitioner will discuss this with your child in sessions. Please speak to your school's pastoral team for a referral to the mental health in schools team. The views of parents and carers are important to us. We welcome your views and input. To get in touch, please contact your school's designated mental health lead.